Welcome to Wellness by Mommy. I hope you are safe and sound. In today's video, let's talk about harmful skincare when trying to conceive. There are some ingredients that are definite no-nos while TTC. Retinol. Retinol is beloved by doctors and patients alike but is not recommended for those who are pregnant or trying to get pregnant. If you're trying to conceive, you want to avoid retinol and retinoids. Studies show that retinol can harm a growing fetus. Retinol can pass through the skin and into the bloodstream, which can then pass to the fetus. Instead of a retinoid, look to using bakuchiol, which is a retinol alternative. It's a natural, vegan ingredient derived from the Cerealia coryllifolia plant. It's a plant that has been used for years in traditional Ayurvedic and Chinese medicine. Bakuchiol has antioxidant and anti-inflammatory properties similar to retinol, which makes it a great alternative to treat signs of aging like fine lines, wrinkles, and uneven tone. The ingredient can also help to firm skin and reduce the size of pores. Remember, just because something is available over the counter and not in a prescription does not mean it's safe. Differin is a retinoid and that should not be used in pregnancy. It's not to be used in pregnancy, so it's best not to use it while TTC. Botox and fillers. Because of a lack of studies on how these injectables may affect a baby, many dermatologists simply will not perform them. Hold off on injectable procedures, like Botox and fillers when trying to conceive. There isn't enough research on injectable therapies to understand the risk they pose to the fetus, so it is recommended holding off while trying to conceive. Accutane. This popular acne treatment must be completely out of the system before you start trying to conceive. The most effective way to prevent acne is by oral prescription of Accutane, which must be stopped 1 month before ceasing the use of birth control or trying to conceive. Instead, use approved acids. Peels and AHA products may help prevent acne and breakouts and are indeed safe to use while TTC and during pregnancy. You can also be mindful of what's going in your body as well as on your skin. The best way to treat acne is with a good diet, i.e. avoiding sugars, good daily skin hygiene, in particular good cleansing to remove excess sebum, as well as topical spot treatments on the actual pimples. Proceed with caution. These are some products that may be okay to use when trying to conceive but should be stopped when you become pregnant. Certain acne treatments, benzoyl peroxide, salicylic acid. Use caution with certain active ingredients used to treat acne, like benzoyl peroxide. Benzoyl peroxide is considered by the FDA to be a Category C agent, which means it is generally considered to be safe to use in pregnancy. Always be sure to check with your doctor about this specific ingredient and how it applies to you. There's such small absorption into the bloodstream that sometimes OB/GYNs will allow for it in individual cases. A similar ingredient to be mindful of is salicylic acid. Absorption of salicylic acid into the bloodstream can also pose risk to a fetus, so is best to cut out any face washes or general use salicylic acid. If you need to put a small amount of a salicylic acid spot treatment, 2% or less, on a zit while trying to conceive, that should be okay. Just use it sparingly. It may be helpful to make a list or have a designated shelf of products that are not pregnancy safe, so, if and when you do get pregnant, you can immediately stop using them. Ingredients to avoid during pregnancy include retinoids of any kind, isotretinoin, tetracycline, as well as essential oils. Trying to conceive is an exciting process that can turn stressful when it doesn't happen right away. It's important to know what you should and shouldn't be using as far as skincare, as the decisions you make could affect your fetus. Talk to your midwife or OB/GYN if you have any other questions about skincare treatments you can and can't use while trying to conceive. I hope you find this helpful. Please subscribe for more interesting, evidence-based, educative and informative videos. Like and share this video. Turn on your notification icon so you can be notified when next I drop a new video. I desire for you good health and long life. See you in my next video. Till then, stay safe and remain healthy. Peace.